So for different conditions, there is a variety of physical examination tests that you can use. And each of these tests has to be able, from a pool of people, from a pool of patients, to identify that this patient indeed has the suspected pathology, but also it has to tell you that with a certain degree of certainty. Okay, and this is where we have the concepts of the sensitivity and specificity of a physical examination test. So when we look at sensitivities and specificities of common physical examination tests, such as the Tinnel sign or Fallen sign for carpal tunnel median nerve entrapment pathology, you can see that the sensitivities of these tests are very small. For example, median Tinnels has only a 23% sensitivity, or a Fallen sign, only a 51% sensitivity. If you are looking at a cervical radiculopathy and you do a Spurling's test, it has a 30% sensitivity. So what does this really mean in the clinical world? In the clinic, what does it mean? Well, what it means is that when you have 100 patients in a room, and you know that all of them have cervical radiculopathy, all of them have a pinched nerve in the neck, a Spurling's test will be positive in 30% of those cases. So that is not really enough of a sensitivity of a test, right? It may be specific, but not sensitive enough. We need to have testing that is both sensitive enough and specific enough, and to maintain a balance between that specificity and sensitivity. If a test is not sensitive enough, you are going to get a lot of false negatives, which means you are going to miss pathologies that otherwise do exist. And that's why in medicine, we are not using only a single tool to help us identify a pathology, but we are using a variety of tools. In this case, nobody says that you shouldn't be using your physical examination test to identify, let's say, a carpal tunnel pathology or a cubital tunnel or a rotator cuff for that matter, but also utilizing other testing such as electromyography testing and musculoskeletal ultrasound testing can enhance significantly both sensitivity and specificity. For example, here, and I don't list the specificities, but EMG testing, it has an 86% sensitivity for carpal tunnel and a 98% specificity for carpal tunnel, which is huge. So, but let's examine usually what is the common paradigm in physical therapy, in chiropractic, and in other fields of medicine. What you usually do is you will do a physical therapy evaluation, an occupational therapy evaluation, a chiropractic evaluation, a medical evaluation, an assessment of that patient using physical examination tests. You will develop a treatment plan, some treatment intervention. You're going to reevaluate that patient. You're going to continue care. And at some point, you're going to end the care. But again, the effectiveness of your treatment depends on your ability to identify correctly the patient's problem, the patient's root of the problem. And this is why many times you need to use diagnostic testing.